Do your legs ache by the end of the day? Do your ankles swell so badly that your shoes feel tight by evening? Do you wake up in the middle of the night with that deep, heavy cramping in your calves that makes you want to get up and walk just to get relief? If any of that sounds like your life, I need you to hear this. Because the pain and swelling in your legs after 60 is not simply the price of getting older. It is not something you have to accept, manage around, and live with forever. A significant portion of it has a nutritional root cause. A specific deficiency in compounds that your blood vessels, your nerves, and the tissues of your legs desperately need, that almost nobody is addressing. And there is one food, one specific nut, that contains the exact combination of compounds your legs need to reduce inflammation, improve circulation, reduce fluid retention, and ease the nerve pain that makes every evening uncomfortable. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health, and today I am going to tell you exactly what that nut is, what it is doing inside your body at a molecular level, and precisely how to use it for maximum benefit. Stay with me, because the science behind why this works is something most seniors and most doctors have never fully appreciated. Before we go any further, and if you are not yet subscribed to this channel, please hit that subscribe button and tap the bell icon right now. I post new senior health videos every single week, videos that give you the honest, research-based information that can genuinely make a difference in your daily life. Subscribe now, then let us get into everything you need to know. Let me start by explaining what is actually causing the leg pain and swelling that so many seniors deal with every single day, because there is not just one cause, there are three distinct processes happening simultaneously in most seniors with chronic leg discomfort. And understanding all three is the key to understanding why this one nut addresses all of them at once. The first process is chronic inflammation in the tissues of the legs. Inflammation is your body's natural response to damage and threat. It is how your immune system heals injuries and fights infection. But after 60, the inflammatory response in many seniors becomes dysregulated. Instead of turning on in response to a specific threat and then turning off when the threat is resolved, it becomes chronically active at a low level throughout the body, a condition researchers call inflammaging. In the legs specifically, this chronic low-grade inflammation causes persistent aching, sensitivity, and stiffness that worsens with inactivity and at the end of a long day. It also contributes to the breakdown of cartilage in the knee and hip joints that accelerates with age. The second process is poor circulation and venous insufficiency. Your veins return blood from your legs back up to your heart against gravity. This is mechanically demanding. It requires healthy vein valves to prevent backflow, adequate muscle pump activity from your calf muscles, and blood vessel walls that are flexible and responsive. After 60, vein valve function declines, calf muscle mass decreases, and the elasticity of blood vessel walls reduces. The result is that blood pools in the lower legs more easily. Fluid leaks from the capillaries into surrounding tissue, and you get the swelling, heaviness, and achiness that is so characteristic of venous insufficiency in seniors. The third process is peripheral nerve sensitization. The nerves in your legs, particularly the longest ones reaching down to your feet and toes, become more sensitive to pain signals as they age and as inflammation surrounds them. Compounds called prostaglandins, inflammatory mediators produced by the cyclooxygenase enzyme pathway, lower the threshold at which nerve fibers fire pain signals. This is why pain that would have been mild discomfort at 40 becomes genuinely debilitating at 65. The nerves themselves are not necessarily more damaged. They are more sensitized by the inflammatory environment surrounding them. Most pain medications for seniors, NSAIDs like Ibuprofen, for example, work primarily by inhibiting the cyclooxygenase enzyme and reducing prostaglandin production. They reduce nerve sensitization and inflammation temporarily, but long-term NSAID use in seniors carries serious risks: kidney damage, gastrointestinal bleeding, cardiovascular events, and fluid retention that actually worsens leg swelling, which is exactly why finding a dietary approach that addresses the same mechanisms without the side effects is so clinically valuable. And this is precisely where walnuts come in. The nut I am recommending is walnuts, and I want to explain in specific detail why walnuts, not almonds, not cashews, not peanuts, are the nut that addresses all three of the processes I just described simultaneously. Walnuts contain the highest concentration of plant-based omega-3 fatty acids of any tree nut. Specifically, a form called alpha-linolenic acid, or ALA. ALA is converted by the body into EPA and DHA, the same anti-inflammatory omega-3 fatty acids found in fish oil, though the conversion rate in humans is modest. But beyond the omega-3 content, walnuts contain a unique array of additional compounds that act synergistically to address inflammation, circulation, and nerve pain in ways that fish oil alone does not replicate. The first mechanism is omega-3-mediated anti-inflammation. EPA and DHA produced from walnut ALA directly compete with arachidonic acid, the precursor to the inflammatory prostaglandins I described earlier, for access to the cyclooxygenase enzyme. When EPA and DHA occupy this enzyme, fewer inflammatory prostaglandins are produced. Nerve sensitization decreases, tissue inflammation in the legs reduces, and the aching, burning pain that characterizes chronic leg inflammation begins to ease. A meta-analysis published in the journal Nutrition, Metabolism, and Cardiovascular Diseases reviewed 14 randomized controlled trials on walnut consumption and inflammatory markers in adults and found that regular walnut intake significantly reduced CRP, C-reactive protein, the primary blood marker of systemic inflammation, as well as interleukin-6, another key inflammatory cytokine. The effect was consistent across studies and was seen with as little as 1 ounce, approximately 7 whole walnuts, consumed daily. The second mechanism is improvement in endothelial function and blood flow. Walnuts contain a compound called L-Arginine, an amino acid that is the direct precursor to nitric oxide in endothelial cells. As I discussed in my blood flow video, nitric oxide is the compound your blood vessels produce to relax and widen, allowing blood to flow more freely. More L-Arginine available to endothelial cells means more nitric oxide production, means better blood vessel dilation, means improved circulation to the tissues of the legs. A study published in the Journal of the American College of Nutrition found that daily walnut consumption for 8 weeks produced significant improvements in endothelial function, measured by flow-mediated dilation of the brachial artery, in adults with elevated cardiovascular risk. Better endothelial function means blood vessels respond more appropriately to the need for increased blood flow, reducing the pooling and stagnation that contributes to swelling and heaviness in the legs. The third mechanism involves the polyphenol content of walnuts, specifically elagitannins and their gut-metabolized derivatives called urolithins. Walnuts contain more polyphenols than any other tree nut, and these polyphenols have direct anti-inflammatory effects in vascular tissue and joint tissue. Urolithins, produced when gut bacteria metabolize walnut elagitannins, have been shown in research published in the European Journal of Nutrition to specifically inhibit NF-κB, the same master inflammatory switch that turmeric's curcumin targets. In the joints of the legs, the knees, the ankles, the hips, this NF-κB inhibition directly reduces the inflammatory cascade that drives joint pain and cartilage breakdown. The fourth mechanism is magnesium's role in muscle relaxation and fluid balance. Walnuts are a meaningful source of magnesium. 1 ounce provides approximately 45 milligrams, which is approximately 11% of the daily requirement for seniors. Magnesium is essential for muscle relaxation. When magnesium levels are inadequate, muscles, including the smooth muscle in blood vessel walls and the skeletal muscle of the calves, remain in a partially contracted state. This contributes to the cramping, tightness, and restless leg symptoms that so many seniors experience at night. Adequate magnesium also supports the sodium-potassium pump in cell membranes, which regulates fluid movement in and out of cells, directly relevant to the fluid retention that causes ankle swelling. The fifth mechanism is vitamin E's protection of blood vessel walls. Walnuts contain gamma-tocopherol, a form of vitamin E that is specifically protective against the oxidative damage that occurs in blood vessel walls when circulation is poor. Oxidized LDL cholesterol, the form that deposits as plaque in arterial walls, requires vitamin E for its oxidation. When gamma-tocopherol is present in adequate amounts, LDL oxidation is inhibited, arterial plaque formation slows, and blood vessel wall integrity is better maintained. This directly supports the small vessels in the lower legs that are most vulnerable to the circulatory decline associated with aging. Now I want to tell you about a patient of mine named Carol. Carol was 68 years old when she first mentioned her leg pain to me. She had been dealing with it for 4 years, a deep aching in both legs that started in her calves and spread to her thighs by evening. Her ankles swelled visibly every afternoon. She had been told by a previous physician that she had venous insufficiency and was recommended compression stockings, which she found uncomfortable and difficult to put on. Carol was not a big nut eater. She had been told nuts were high in fat and calories. She avoided them deliberately. I recommended that she add 1 ounce of walnuts, a small handful, about 7 whole walnuts, to her breakfast every single morning. Nothing else changed. Same diet, same medications, same activity level, same compression stockings she was already inconsistently wearing. At her 6-week follow-up, Carol told me her evening leg pain had noticeably reduced, not gone, but significantly less intense. At her 3-month follow-up, the ankle swelling she had been measuring by how tight her shoes felt in the afternoon had reduced meaningfully. At 6 months, she described her leg discomfort as manageable in a way it had not been in years. Her CRP, which I had measured at baseline and repeated at 6 months, had dropped from 3.8 milligrams per liter to 1.9 milligrams per liter. Her endothelial function, assessed indirectly through blood pressure measurements, had also improved. 1 small change, 1 handful of walnuts every morning, 6 months of consistency. I am not telling you that walnuts are a cure for venous insufficiency or peripheral vascular disease. I am telling you what the research shows and what I have seen clinically, that the specific combination of anti-inflammatory omega-3s, L-Arginine, polyphenols, magnesium, and vitamin E in walnuts addresses the 3 core processes driving leg pain and swelling in seniors in a way that no other single food matches. Now let me give you the practical details of exactly how to use walnuts for maximum benefit, because there are several important points that determine whether you get results or not. First, the amount, 1 ounce per day. That is approximately 7 whole walnuts or 14 walnut halves. This is the dose used in the majority of clinical studies showing anti-inflammatory and cardiovascular benefits. More is not necessarily better. Walnuts are calorie-dense, and consuming 2 or 3 ounces daily adds significant calories without proportionally greater benefit. 1 ounce, consistently, every day. Second, the timing. Eat your walnuts in the morning with or shortly after breakfast. There are 2 reasons for this. The omega-3 fatty acids in walnuts are absorbed more efficiently in the presence of dietary fat from breakfast foods, and consuming anti-inflammatory compounds in the morning means they are active in your system throughout the most physically active part of your day, when you are on your feet, when inflammation tends to accumulate. Third, the form, raw or dry roasted walnuts only. Not oil roasted. The high-heat oil roasting process oxidizes the delicate omega-3 fatty acids in walnuts, converting them from anti-inflammatory compounds into pro-inflammatory oxidized fats that do the opposite of what you want. Not salted if you are managing blood pressure or fluid retention. Raw walnuts are best. If you find the flavor too bitter, a light dry roast improves palatability without damaging the omega-3 content. Fourth, storage. Walnuts go rancid faster than almost any other nut because of their high omega-3 content. And rancid fats are inflammatory, not anti-inflammatory. Store your walnuts in an airtight container in the refrigerator or freezer. If your walnuts taste bitter or smell off, they have oxidized and should be discarded. Fresh walnuts should taste mild and slightly buttery, not sharp or chemical. Fifth, consistency. The anti-inflammatory and vascular benefits of walnuts accumulate over weeks and months of consistent daily consumption. You will not feel a difference after 3 days. You will begin to notice a difference, as Carol did, after 4 to 6 weeks of genuine daily consistency. Give it 3 months before you assess results. 3 months of 1 handful every morning. Let me also give you 3 things that work directly alongside walnuts to accelerate the results for leg pain and swelling specifically. The first is compression. Graduated compression stockings, worn from when you get up in the morning until you go to bed at night, directly counteract the venous pooling that causes afternoon leg swelling. They work best when combined with the dietary approach I have described because compression addresses the mechanical problem while walnuts address the inflammatory and vascular problem. Together they work on both root causes simultaneously. The second is calf raises. As I have mentioned in my blood flow videos, your calf muscles are the second heart of your circulatory system. 10 to 20 slow calf raises twice per day, holding a chair or counter for balance, directly activates the venous pump mechanism that moves blood out of the lower legs and back toward the heart. This is the single most effective non-pharmaceutical intervention for venous leg swelling that exists, and it takes 2 minutes twice a day. The third is elevation. When you rest during the day or sleep at night, elevating your legs above the level of your heart, even by placing a pillow under your ankles, uses gravity to drain the fluid that is pooled in your lower legs throughout the day. Combined with the vascular benefits of walnuts and the mechanical support of compression, elevation at rest completes a three-part approach that addresses leg swelling from every angle. Let me bring everything together for you. Leg pain and swelling after 60 is driven by three processes: chronic inflammation, impaired circulation and venous insufficiency, and peripheral nerve sensitization. Walnuts address all three through 5 distinct mechanisms: omega-3 anti-inflammation, L-Arginine and nitric oxide production, polyphenol and urolithin NF-κB inhibition, magnesium for muscle relaxation and fluid balance, and vitamin E protection of blood vessel walls. 1 ounce of raw or dry roasted walnuts every morning with breakfast. Stored in the refrigerator. Consistent for 3 months minimum. Combined with compression stockings, calf raises twice daily, and leg elevation at rest. This is not a miracle. It is a nutritionally grounded, research-supported approach to addressing the actual biological causes of the leg pain and swelling that is making your days harder than they need to be. Carol got her life back 1 handful at a time. You can too. If this video gave you something genuinely useful today, please do 3 things. First, give it a thumbs up. It helps this information reach more seniors who need it. Second, leave a comment below and tell me, do you deal with leg pain or swelling after 60? And have you ever tried walnuts consistently? I personally read every comment on this channel and reply to as many as I can. Third, share this video with someone in your life who is dealing with leg pain, swollen ankles, or poor circulation. You might be giving them the one piece of information that changes how they feel every single day. Subscribe to this channel for weekly senior health videos that are honest, practical, and grounded in real science. I am Dr. Michael Kent. Thank you for watching. Your legs carry you through everything that matters. Give them what they need. I will see you in the next one.